I'm joined by Nikki Mattocks, an anti-stigma activist with Time to Change, Dr Laddie Smith, who's a consultant psychiatrist and a member of the Schizophrenia Commission, and by the editor of this week's new report, clinical psychologist Anne Cook. And from our Salford studio, I'm joined by Anthony Scally, the author of Eyebrows and Other Fish. What was it like to receive a diagnosis more than 20 years ago?
I was diagnosed with schizophrenia and I was told I'd be on some sort of medication the rest of my life. My mother was told that I would never be the same again. On a personal note, I've often felt like a square peg in a round hole. I don't hear voices. I'm not sure which diagnostic tick boxes I've ticked, but I don't think a diagnosis of schizophrenia is required to treat somebody that has psychotic events. And they are events, I don't think they're symptoms.
And was there something in particular about that label of being told you had paranoid schizophrenia?
Absolutely. I mean, it's something that needs to be changed because of the connotations. I mean, schizophrenia, if you look at it literally, in the Greek, it's split mind, but that's not what it means. It doesn't mean we're split into two personalities. If that were the case, that would save me on bedroom tax, you know.
Would it have been easier for you if it had been called something different?
If we're going to have a diagnosis of schizophrenia, which is an umbrella diagnosis, whatever that means, or a spectrum, if we're going to have it, let's call it sunflower syndrome, you know, something nicer.
Now, Nikki Mattocks, you're 17 years old. What's it like for you hearing what Anthony's experience was when he was treated 25 years ago and was told his diagnosis like that?
I can relate to it quite a lot because when you're given this label, it's hard to relate to it, I think, because I always thought, well, I'm a person, I'm not this, I'm not that, I'm me. It's just sad that people are treated as mental health problems rather than people.
And what sort of attitudes have you experienced from other people since you've been having help?
I've experienced a lot of stigma and discrimination, especially around the fact that I experience like hearing voices. People have told me that I must be a murderer or I must be being told by these voices I experienced to kill children. I just don't understand because I might hear voices, but I'm not a violent person and it just doesn't change who people are. So, yeah.
Anne Cook, we've heard two experiences there of what it's like being given a diagnosis. And in this new report that you're publishing this week, how much does this whole issue of diagnosis feature? I mean, sometimes we hear on the programme from listeners who are relieved to have a diagnosis because it explains what was happening to them for them and it gives them some kind of explanation. Other times, as Anthony's described, it can be stigmatising in itself and a frightening thing in itself.
Well, our report is called Understanding Psychosis and Schizophrenia, but in a way the subtitle is more important because it actually explains what we mean, because often people don't know what these terms mean. So the subtitle is Why People Sometimes Hear Voices, Believe Things That Others Find Strange, or Appear Out of Touch with Reality, and What Can Help. And I think it's true that people are sometimes relieved to get a diagnosis because they have an idea that it explains what's going on. But actually, diagnoses in psychiatry are more descriptive than explanations. They appear to explain something, but they don't actually. All we actually know is that people have these experiences, or in fact, all we really know is that they describe to us that they have these experiences. Everything else is our way of understanding that. There's an assumption that they're caused by a biological process, an illness process, a disease process. But actually that's an assumption. There aren't actually hard signs of that. In fact, there's a lot of evidence over the last 10 years, or maybe 20 years actually, that sometimes these experiences can be very related to things that have happened in our lives, particularly trauma or maltreatment as a child. So it's certainly not the case for everybody, anyway, that a biological disease process is responsible for those experiences. And what we're suggesting in the report is that it would be much more helpful if services were honest about that and said, you have these experiences, let's sit down together and work out some of the things that in your particular unique case might have contributed to those experiences and then what might help you, rather than having a kind of one-size-fits-all approach, which is if you come to us saying that you hear voices, we'll tell you that you have schizophrenia and that you need to take medication, probably permanently. And both of those things, both the diagnosis and the medication, have all kinds of effects, some of which people find helpful and some of which they don't. but we're arguing that we need a much more individual approach.
So, Dr. Laddie Smith, you're a psychiatrist and you were a member of the Schizophrenia Commission. How much do you think that attitudes to psychosis have changed within the profession? I mean, not just since your report 2 years ago, but, 5, 10, 15 years ago. Are you seeing these kind of changes? Are people being treated more as individuals?
Well, I think they are, actually. Since I started training in 1992, there's actually been quite a significant change in attitudes of professionals towards treating and even diagnosing mental health problems, severe mental illness in particular. But I would say that probably since around the late 90s, and funny enough, I think it probably coincided with the advent of the newer antipsychotic medications, that meant that people had to have a debate about what we were actually doing. That meant that people started to say, well, hold on a minute, it's not just about medication. There's also the person's psychological state, their social situation, there's their family. There are all these other factors that come into play when it comes to treatment. And therefore, people start to think more about the antecedents of psychosis. And actually, people start to realise that there isn't just one route into psychosis. There are a number of different routes into psychosis. And therefore, there are individual ways of managing that person's psychosis and helping them to learn how to look after themselves.
Anthony, I'd be interested to know whether you've noticed a difference over time in the approach. Do you feel more treated as an individual now? And do you find staff trying to help you find meaning and trying to ask what's going on and why?
It's certainly different, a lot more non-judgmental. Even years ago, there was no nurse ratchets, People were doing what they thought was best.
And we heard there that things do sound more positive, but you're saying in your report there is still a long way to go. What sort of changes do you want to see when it comes to treatment of individuals?
I think the main thing that we want to change is for mental health professionals to be a bit more humble. We've had a service user and survivor movement in this country for a long time, but a lot of the time people have just been asked for their stories, and now I think we're coming to realise that we can't go on not listening to those. We have to work with people's own understanding of what's happening. So I think, yes, humility.
Nikki, have you felt listened to by the staff that you've seen?
Sometimes people they want to give you a label because it's easier to deal with that way. They'll just give you a label, put you on some medication, and then they just hope it goes away. But it never does until you deal with the actual cause of it, until you talk about how you feel. That's how it gets better. If you've got a label of something, then they tend to think, oh, well, this is why you're experiencing. But people get misdiagnosed all the time. I mean, I've had so many different labels chucked about, and I've just given up on listening to them now because I'm just myself and I experience what I do. And I don't really care about the labels that I get, really.
And do you get listened to in terms of what kind of treatment you would prefer to have?
No. When it comes to the hearing voices, I've never really had much treatment around it. All I've had for that is just been given some medication and drugs and said, out of 10, how much has the voices gone since she's taken this? If not, then let's try another drug. Then all I really wanted was to talk about it and say how it made me feel, what I was experiencing. But I never got that because all professionals did for me personally is just give me some drugs because they hoped that would sort it. But it never did, and it still hasn't.
And are the voices the thing that distresses you most?
Yeah, out of all aspects of the illness over the past few years or whatever, the voices of the thing that scare me the most and that thing I find the most difficult to deal with, but it's the thing that I've never been able to talk about or go into detail about because they just hope drugs will sort it, but they never do.
I mean, Laddie, your unit was shortlisted for the Psychiatric Team of the Year award, so I'm guessing you make sure that your patients can make choices and that you listen to them, but is it possible that you're more forward-thinking than some of your colleagues? Are there still some who be very much keeping to a very traditional medical model and a paternalistic model in a way?
I would say to people, have heart. There are many, many, many psychiatric professionals out there who have a much more, for want of a better word, holistic approach to things. And I'm always a little bit surprised to hear that people are not talking with the people that they're working with, because I don't really understand how you could possibly know what to do without talking to people and listening to what they have to say and listening to their experiences. And I know I'm not alone in that.
Anne, are you as optimistic as Laddie is that things are changing and that there is all this progress?
Yes, I think it's true that there is a lot of progress. I think that the main thing that we're arguing for is that mental health professions should acknowledge that mental health is a contested area. Our knowledge is very, very tentative, so we need to respect and work with people's own ideas about what has contributed to their problems. And we shouldn't insist, this is, I guess, the crux of it, we shouldn't insist that people see their problems as an illness. As workers, we think it's our job to cure illness and to tell people what to do. And I guess that's one of the things we're arguing for, is get away from this idea of prescribing, not only prescribing medication, because some people do find medication helpful, but prescribing what people should do and how they should understand their problems, because we don't actually know.
So, Laddie, in your unit, would it be presented to people as this is an illness, or this is a set of experiences that you're having?
Well, it depends on the individual, actually, and I actually think sometimes it is useful for people to know that actually there's something here that is affecting my ability to function. I run a forensic intensive care unit. The people are really very unwell. Their experiences are very distressing often. Now, whatever you want to call it, it's stopping them from being able to function in the usual way, in the way that they want to, and it's actually stopping them from fulfilling their potential. And so actually much of the discussion is about the fact that this is a problem that's stopping you from fulfilling your potential, and we think we can help you to learn ways of managing it. I personally don't have a problem with calling it an illness. For some people, it's not so helpful, and certainly what we wouldn't do is to dwell on whether or not the person calls it illness or not. That's not really the issue. It's more about whether the person understands how to look after themselves and keep themselves well.
Nikki and Anthony, I'd like to ask both of you finally, if you could change one thing about services or about treatments that would make things easier for you, what would you change, Anthony?
It's just this word schizophrenia and who we represent and what it represents and who represents us. Even White Van Man doesn't represent me. He probably despises me.
And Nikki, what one thing would you change?
I would say I'd really hope that people would be listened to earlier, because in my experience, and a lot of people I know's experience, people aren't listened to until it's classed as severe enough, and then people just get worse and worse and reach crisis when it could have been prevented. So if I could change anything, I'd hope that people could be listened to before it reaches crisis.
Nikki Mattocks, Anthony Scally, Anne Cook and Laddie Smith. And next week we'll be looking at the future of drug development for psychosis, asking what kinds of new medication are on the horizon. The mind and body are, of course, linked, and we all know that what you're doing